Now to growing concerns about the deadly coronavirus officially hitting the U.S. Here's what we know.
At this moment, we have 22 patients in the United States currently that have coronavirus.
The first death from coronavirus here in the United States.
Breaking right now, sources telling Channel 2 the Houston Livestock Show and Rodeo will be shut down for the rest of the season.
Every American has a role to play in defending our nation from this invisible, horrible enemy.
More than 250,000 coronavirus-related deaths. That chilling number expected to climb as hospitalizations reach an all-time high.
A major breakthrough has been announced in the development of a vaccine for coronavirus.
We're going to go on offense against this virus. That being said, the task of vaccinating 300 plus million people in the United States is a daunting one.
I can vividly remember in January, first of all, reading mainly on the news media at that point about the outbreak in China and thinking, well, we better pay close attention to this. This could be like the first SARS outbreak, which spread to a few other countries, or it could be even worse. It could be the start of a pandemic.
We've done a superb job, I think, of early recognizing the severity of the pandemic and preparing our faculty, our staff, our hospital facilities for this global pandemic. Also, we've been a tremendous asset, I think, to the region and to the state, especially early on in providing diagnostic capabilities. Over the course of the response, we ended up providing diagnostics within the laboratory here, early on in a test that we made ourselves and got validated, to about 27,000 individuals. And this was not only Galvestonians, but also all across the state. In fact, we've tested samples from representatives from almost all the counties in Texas. And then nationally and globally, our scientific contributions have been just absolutely astonishing.
UTMB contributed in many different ways in a very big scale. Specifically, UTMB was one of the first institutions that received the first isolates from the COVID patient from Washington State. And based on that, UTMB shared globally of the isolates and the materials for both basic research and diagnostics and product development.
We are very fortunate here. When the first cases came into the United States in Seattle, we were fortunate to get a sample because this is our Galveston National Lab is also an international reference laboratory where scientists everywhere send us specimens of new and emerging infections because we have the facilities to store them, maintain them, and share them with others in experiments.
We developed the first reverse genetic system. And that what that entitles is we are able to make and manipulate or engineer the virus on a petri dish in the lab. So that's one of the most important tools to study a virus because you can engineer any genetic footprint, any protein at amino acid level, and you can make those changes. In that way, when the virus infects the cell, it turns cell, for example, into green or into red. In this way, you would be very easy visualize where the virus is infecting.
I want to assure people that there are very good reasons to believe that the vaccine is safe and efficacious. So first of all, the vaccine very clearly protects us from coronavirus disease, from COVID. Over about 95% of people vaccinated who were exposed to the virus after vaccination in the clinical trials had protection from that disease. Those people also are protected from being infected in the first place and therefore protected from spreading the virus to others. And that's going to be really critical going forward.
We have the vaccine, but getting that vaccine into people's arms is the next challenge. And we really need your help in convincing your friends, neighbors, and loved ones how important it is to access one of the local sites and get on a list to get your COVID shot. We have been designated a vaccine hub by the state of Texas, which means the governor allocates us additional medications. And in doing that, over the last several weeks and months, we have actually been able to already vaccinate 9% of the population in Galveston County.
Ultimately, it's everyone's choice whether they want to get a vaccine. I think you've got to think of two aspects to this. The first one is, do you want to have COVID? And if the vaccine's going to prevent you getting COVID, then that's something you should do. And then I think there's that responsibility to the community. Not everybody can take a vaccine because they have some health conditions, they're immunosuppressed, they're pregnant, and they can't have the vaccines. And I think it's up to us in the community who can take a vaccine. We need to help protect those people. We call it herd immunity.
As the pandemic continues and as more and more people are vaccinated, people should see the impact, the protection that is offered among those that are vaccinated. And I think that they would be well advised to stand up and get the vaccine because it's absolutely essential to our control of the global pandemic.
We are very thrilled by the award from the Galveston Regional Chamber of Commerce. It is a result of years of work at the university of accumulating a team of scientists with international reputations whose work is focused on international problems.
I think the community has a great respect for what we've done, and that appreciation, I think, comes across to us who work here, which makes it a great place to work. And you can't overemphasize how much it is to be a part of the community. Everybody wants to be part of the activities, and I think that's a really great environment to live in and work in.
I will express my great gratitude to the Chamber and to the community for the enormous support over the past few decades. The community has been so supportive, and in return, the UTMB has led the world in developing the vaccine and therapeutics and the research. And I hope those products coming from the UTMB effort can in return help the community